So there are certain criteria that we consider when deciding if someone is at risk for colon cancer. So the first thing to appreciate is that the average risk individual is anyone who is 50 years old. Added to that risk would be if you had a family history of either colon cancer, rectal cancer, or colonic polyps. And anyone in that category would be at a higher risk than the average 50-year-old to develop polyps and then colon cancer. Some other risks of colon cancer would be other medical conditions like inflammatory bowel disease, so ulcerative colitis or Crohn's disease, which affects the colon, would put a patient at an increased risk of colon cancer as well. And then obviously there are symptoms that one may have which could make one more likely to have a growth in their bowel, which would put them at an increased risk of colon cancer. There are some other cancers which are potentially associated with colon cancer. So if someone had a family history of other ones, such as ovarian cancer or breast cancer, it is thought that possibly they are at an increased risk of developing colon cancer. A controversial topic is diet, and how does diet impact one's risk? And we know that people who have a strict vegetarian diet are at a reduced risk of developing colon cancer. But saying that patients who have not grown up with that and then change their diet to become a vegetarian or to increase the fiber in their diet doesn't seem to impact their risk at all. There's been recent evidence that two other clinical characteristics put someone at a higher chance of developing colon cancer. That would be obesity or smoking have been recently shown to increase one's risk of developing colon cancer.